What is a pineocytoma brain tumor? Imagine a tiny, slow-growing growth inside your brain that is usually harmless and often goes unnoticed for a long time. That's what a pineocytoma is. It is a rare, benign tumor that develops in the pineal gland, a small pea-shaped structure deep in the center of the brain. The pineal gland's main job is to produce melatonin, a hormone that helps regulate sleep and wake cycles. Because pineocytomas grow slowly and do not spread to other parts of the body, they tend to have a good outlook when treated properly. Symptoms of a pineocytoma can vary depending on its size and position. Since it is located near important brain structures, it can cause headaches from increased pressure inside the skull. Some people may experience nausea or vomiting, especially if the tumor causes a buildup of cerebrospinal fluid. Vision problems like blurred or double vision are also common because the tumor can press on nerves that control movements. In some cases, the tumor can lead to hydrocephalus, which is a buildup of fluid in the brain, causing further pressure and symptoms. Because of its location, a pineocytoma might also cause issues with memory or balance, especially if it affects nearby parts of the brain. To diagnose a pineocytoma, doctors usually start with imaging tests like computed tomography scans or magnetic resonance imaging scans. These scans help visualize the tumor's size and position. To confirm that it is a benign pineocytoma, a biopsy is often performed, where a small tissue sample is taken and examined under a microscope by a specialist. This helps distinguish it from other types of brain tumors. Treatment mainly involves surgery to remove the tumor. Since pineocytomas are slow-growing and benign, removing them completely often results in a good outcome. If surgery isn't possible due to the tumor's location or other health factors, radiation therapy might be used to control its growth. Chemotherapy is rarely needed because these tumors are not cancerous and tend not to spread. The prognosis for pineocytomas is generally favorable. They are classified as grade I tumors by the World Health Organization, which means they are low-grade and less aggressive. However, because of their location deep in the brain, surgery can be challenging, and recovery depends on how much of the tumor can be safely removed and the person's overall health. It's important to remember that each case is unique, and ongoing monitoring after treatment is essential to ensure the tumor does not recur. In the context of brain health, pineocytomas stand out because they are benign and tend to have better outcomes than malignant brain tumors. Still, they requiring careful diagnosis, treatment planning, and follow-up care. If you or someone you know experiences symptoms like persistent headaches, vision changes, or balance issues, consulting a healthcare professional is crucial. They can provide personalized advice and determine the best course of action based on individual circumstances.